POMS syndrome is a rare paraneoplastic syndrome, and therapies for POMS syndrome are aimed at eradicating the plasma cells in the bone marrow. In myeloma, we have a lot of data about novel therapies for eradicating those cells, but in POMS, we still do not have data on how these therapies work and if they're safe. We have only actually one randomized clinical trials that evaluated therapy in POMS. And this was a trial that evaluated the role of thalidomide, which currently is less used. We have a prospectively maintained database, and we have all the data of all patients treated at Mayo for POMS syndrome. And we found 16 patients that received novel therapies. Novel therapies, we define them as Daratumumab, Pomalidomide, and Carfilzomib, and Elotuzumab. And we analyzed their data in terms of efficacy and in terms of safety. Out of these 16 patients, 15 were male, and 75% underwent a stem cell transplant prior to the novel agent therapy. The median time between diagnosis and novel therapy initiation was 50 months, and it was a median of 2 prior lines of therapies. So we looked at response in terms of hematologic response, PET response, VEGF response, and clinical response. And we saw great responses with these novel therapies. So we had 15 patients treated with Daratumumab, and 9 of them responded hematologically with deep responses, so CR or VGPR, and 7 patients had VEGF responses, 5 patients had PET responses, so responses were great. 5 patients received those therapies only with dexamethasone, and all others received it in various combinations, so Dara with POM, Dara with Rev, Kyprolis with Rev, so all these combinations we usually use in myeloma. In terms of safety, which is very important, so we have a median follow-up of 38 months. Just 1 patient of this cohort died, and none of them died actually on therapy, so therapy was safe. We had 7 cases of hospitalizations because of pneumonia, so not a lot of cases of infections, which is a huge issue with these patients. And 4 patients hospitalized due to volume overload, which is an issue for these patients. And 4 cases of infusion-related reactions to Daratumumab. So I'll summarize and say that the therapies were effective and safe, but we need more data. We need randomized trials to evaluate the therapy and the sequencing of therapy, because currently we don't know how to sequence these novel therapies.